Right, thank you so much, first Louise, and thanks to Paul for inviting me to give a little chat endodontic-wise. I hope you enjoy it, as I did researching. I'm a dentist practice limited to endodontics, 5 days a week. I work in the northwest of England, and it's my passion. Sometimes I wonder why. I'm sure the patients wonder too. I'm hoping that this webinar is going to work smoothly. My broadband has been temperamental, as I'm sure most of you also have been experiencing with everyone on the Zooming. But let's see how we go. Right, as you can see, it's going to be a science fi theme. We're going to be searching. We're going to be searching for the future, but really what we're going to be using for today. So our mission that we've been charged with is choosing an endodontic file system for the 21st century. We're going to search far and wide, and hopefully through the end of the journey, we'll come to some type of idea of where we should be heading. I need to just put aside a disclaimer. I sell quality endodontic instruments and materials at this address, proendo-shop.co.uk. Right, so how do we choose the files that we use? Or more specifically, how did you choose the files you use? It's should be a matter of that we made these choices, and hopefully some thought has gone into it. Well, I suppose we wanted to have a simple system. We wanted something that's fast to complete the filing. The cost was is a factor. We wanted a file system that's safe, that's not going to introduce iatrogenic mishaps. We don't want files breaking. And obviously to keep to the canal spatial orientation. Lots of us went on a course, and of course have chosen the files that we use by being branded by a marketing company that gave us a free lunch. So life is all about making choices, and we hope that that we're going to do our best to make the right ones, but at least we can learn from doing the wrong ones. I'm not saying that the file system that you're using are wrong. Not at all. But maybe we need to just put a little bit more thought into why it is that we're using these files. What is so special about them? Why are we getting the results that we do? So again, we ask, how do these file systems differ? If we were to choose a different file system, why would we do that? So looking at our own files, let's see how do they differ in reality. Well, by the wire designs, they could be square, rhomboid, or triangular. Of course, just before we move on, the square rhomboid are going to be a slightly more, if you want, more robust, but not as flexible as the triangular type of wire. The core metal, is it twisted or machined or even treated? The taper, is it single or variable? Is the file system, is it for rotational files, or is it reciprocation? And is the file, does it follow a symmetrical, as it rotates symmetrically or asymmetrically with a bit of a wobble? Some of them even have alternate cutting. So they could differ by the manufacturing. So we've explained it before. There could be machines that's the H file, the headstrong file, or NITAR files or machines. By grinding and twisting, that means raw wires ground into tapered geometric lengths, either square or triangular or rhomboid. The file system could differ by the file design. So there are many different components to the file, and we need to look at the taper, the core, the flute, the cutting edge, the land, the helix angle, the pitch, the rake angle, cutting angle, and tip design. But we're only going to look at a few of them, the ones that are underlined. So what is the core? The core is the cylindrical part of the file with the circumference that's bordered the depth of the flute. So the bigger the diameter of that core, of course, the stronger the file is, but the less flexible. The flute is the groove in the working surface used to collect the soft tissue and the dentine debris. The lands, three really important things, is they prevent screwing in of the file, limits the depth of the cut, maintains the file in the center. The helix angle, that's the angle formed by the long axis from the cutting edge to the long axis of the file. It helps in removing debris caught in the flute. If you have debris caught in the flute, so it's going to reduce the cutting effectiveness of the file. And that means that there's a greater chance that the file might separate or fracture. The rake angle can be positive or negative. Positive rake angle means that it's much more aggressive cutting. Just a visual part of what it looks like. So there's the core on the left, then the flute, that's the groove between the cutting edge, the land, and the helix angle, and the rake angle. So we have a close look at your file systems. You'll see that, and if we compare them, we'll see that things are changed between the different systems. And they, through these changes, they're going to give different properties of the filing. And in that way, they might be more efficient. So it's worth having a look at carefully. Historically, the science of the file design was revolutionized by the advent and incorporation of nitrile metals. The advantages, we are all familiar. That gives increased flexibility, improved strength, torsional resistance, and cyclic fatigue stress, and shape memory, etc. So the file systems can also further be compared and can differ to the taper. You can have a single taper or variable taper. Variable taper is usually just in one file, you can have change in taper. And so usually with this coronal to the tip, we're going to get more cutting, greater cutting at the coronal part and less at the tip. Non-cutting, what's the advantage of non-cutting safe tapered file tips? Tapered end will allow for cleaning past the constriction and decrease the chance of taper lock. Taper lock is when the full cutting edge of the whole file engages in the dentine. So that means that any further rotation requires a greater torque. And in that case, there's a greater chance that you might have a file fracture. The other file systems must not go past the foramen, or else you may lose compaction, resistance, and obturation. So these are the main difference between the two file systems when we look carefully at how are you going to finish at the tip. So let's look carefully at the taper. There's the profile, which has 3 tapers, 2, 4, and 6%. K3 is 2, 4, and 6 as well. Very similar to the K3 in the profile. I think the K3 was at a positive rake angle, and that means it was much more aggressive than the profile. Race has 2, 4, 6, 8, and 10%. Quantec has 2, 3, 4, 5, 6, 8, 10, and 12%. The M2, 4, 5, 6, and 7. The greater taper, 4, 6, 8, 10, and 12. And the pro taper has variable taper. I wish I could actually speak to you face to face and find out which system you're using and, you know, why. I think it would be easier if we could, in a way, stick with one taper. Like the Quantec is a little bit confusing, and I suppose people using Quantec don't find it, but just looking at it, there's a lot of tapers to choose. And when we're faced with that, you know, during the, you know, while working, it's might confuse you. You might have the wrong file out, for example, especially around at this time with COVID. You can't expose all the different files to the AGP. Right, but so we've compared all the different file systems. So far, I haven't really said anything new, have I? I've classified them, but of course the subject is not exhausted. So what is really new? Which file system is the best choice for the 21st century? What's new? So when you've got a question like this and you need to compare things, we've got to go to the experts. We've got to find out who can help us. And unfortunately, I don't think they're going to help us much, are they? So let's go back and let's go and see what's really important to you. And maybe this way will help us find out which way we should be going. So how did we choose the files that we use? And so we suggested we wanted a simple file system. So my thoughts are that you shouldn't be using more than 3 or 4 rotary files per tooth. Any more is just going to lengthen the procedure. And there's, whenever you put a file in the tooth, there's more chance of things going wrong. Single file systems are useful in most canals, but not all. And I think that's important for all of us to recognize and to remember that a canal is not cylindrical. Even if we work to a large size tip file, there's going to be parts of the canal that are going to be uncleaned. And with a single file system, you're just not going to clean those areas. And that's what leads to failure. The speed to complete filing, rotary files are all similar. They're running at between 350 and 500 RPMs. So maybe by passing it, the way you use them might take a little bit longer, but they should really take the same amount of time. So we can't really compare them. The cost, this is where they differ. This is easy to quantify. We'll look at that in a minute. Safety, there are variable factors and debatable superior safety features. We've shown that the file design really, there's so many components, how it's machined, and just the design of them. So it's very hard for us to really compare them and say which one's safer than the other. So that's a bit hard. Of course, those on the course haven't given that much thought. So let's have a look at the cost factor. So the blues are the Henry Scheins, the greens, the QED, and the yellow, the dental directory. On the left, the edge taper is just over 22, 25 pounds per probably a 6-pack. System GT, just under 67. The K3, now we can compare 2 companies. One about 45, and dental directory is a little bit cheaper, at about 40. Cyber Endo I'm not familiar with, it's about 15 to 20. Pro Taper Gold, again we can compare the Henry Schein and dental directory. This time dental directory is slightly above it, at just over 45. Pro Taper next, which I believe is 3 files in a pack. They're under 45. So a lot more expensive, in fact, per file. Profile, 67. And compared to the QED, just under, is a little bit cheaper. Triniti, under just over 22, 25. M2, just about 40. Reciproc, that's probably the most expensive. Again, I think there's only 3 in a pack. With at QED, just under 90. And Wave 1 is just about 45. Again, I think 3 in a pack, but I might be mistaken. So, seems that we've got a mystery file at about 22. We'll come back to that. So we're still searching. We're searching far and wide. And you've noticed that I haven't really compared the different files with regard to the designs and tested outcomes in clinical or laboratory setting. There are numerous research articles declaiming their file as superior. I'm not going to enter into the debate. It's like getting a utility bill and trying to change over and then trying to look at and see which one is the better option? I don't know. I find it impossible. I pass it on to my wife to choose them because there's so many different. We're not comparing apples with apples. Anyhow, anyway, basically, I think all these file systems are good in your hands. And that's an important point to make. So right now, I suppose you can switch off, leave the meeting, don't. But I think I've given you an answer. They're really good in your hands. If you're getting good results, fantastic. But I think we're always trying to learn and see if we can do better. We're trying to improve our work, make the root tree looks pretty. I think the prettier the obturation, the better the results, as I found. So I'm going to try and offer you something, right? Let me explain. I mentioned in an earlier slide that NITAR files have an important factor besides all their strengths, and that was shape memory. What is shape memory? The best description that I would like to make, or rather to present, is a visual demonstration of what does not have shape memory. Let's see if I can do this. Right, here I am again, and I'm going to hold, whoopsie, I think I've already done it. Okay. Can you all see that? That's a paper clip, which I've just bent in my excitement. Okay, so we've got a paper clip, and if we bend this paper clip, you'll see that it does not spring back to its original position. That means that it doesn't have shape memory. Now imagine taking this file, okay, you can all see it quite clearly. We bend it, pre-curve the files, remember, and we rotate it. Let's go back to my sharing. Right, so we've imagined that we've pre-curved a stainless steel file without shape memory in a curved canal. You can expect canal distortion, loss of central spatial orientation, apical zipping, and foramen transformation. So that doesn't seem a good idea. So we don't take a file without shape memory into the canal. That's an important step, important point. So why were files made with shape memory? Okay, we've just answered it. But I think there was an added benefit. These files were made more flexible and had greater cyclic fatigue, torsional resistance, and strength before fracture. So let's take now a look at our rotary NITAR file. So we'll go back to a little demo. And here's a conventional NITAR file, any one you want. And if you see, let's hold that carefully. Oh. Right. I'm bending it, and as I bend it with a lot of force, we can see that it springs back to almost its original position. So a canal that's curved, as it rotates, it doesn't hold that position and cause that change in the canal. It will spring back and bend as it rotates along. So it seems we're at a point now that we're going to shake things up. So now I want to introduce you to a file that will hopefully serve for the next generation. And these are metals without shape memory. This seems to contradict what I've just demonstrated. And we didn't find a monster, but a friendly alien when we did this. But in order to explain why I'm suggesting this, let's go into to explain how do they do this? How do they lose shape memory? So there's different processes. There's the thermal, machining, or surface treatment of alloys. And there are two alloys of the NITAR metal. The austenitic phase, conventional, it's conventional NITAR, M wire, and R phase. The martensite phase, that's this, for example, CMY, gold, and blue heated treated NITAR. Let's go a little bit more detail. And we'll speak first about the R phase. The R phase alloy have more flexibility, torsional resistance, cyclic fatigue resistance. It has cyclic fatigue resistance than conventional alloys with the same geometry. Also, when used in reciprocation motion. However, they have low torsional resistance than M-wire alloys. M-wire alloys are produced by a series of heat treatment and annealing cycles, which give them the superior strength due to stable nanocrystalline martensitic structure. Alloys with gold thermal treatment, they have they've been put under a lot of high temperature, depending upon size and taper. Max wire alloys, martensite, austenite, electropolished flex. This new technology allows the file to attain martensite phase when cooled and austenite phase at body temperature. At austenitic phase, its superplasticity can easily adapt to canal irregularities, reducing stress on files. Electric discharge machining, or EDM technology, is a non-contact thermal erosion process in which electric sparks are used to melt and vaporize the top layer of nitrile alloy, reducing surface defects. This increases the fracture resistance of files. Blue phase treatment. This is when the surface of the nitrile alloy is treated with titanium oxide, which increases the surface hardness, wear resistance, cutting efficiency, and flexibility of the file. So let's now have a look at all the file systems that you're probably using. Conventional nitrile alloy is in the austenitic and the superplastic, M2 profile protaper, the protaper file, electropolishing, which increases the torsional resistance by race, R phase, austenitic, it's austenitic, superplastic, or twisted, that's the twisted files, K3XF, which is not twisted, M wire, austenitic with varying amounts of R phase and martensite, superplastic, two-stage stress-induced transformation through an R phase. For example, the profile vortex, profile GT series X, protaper next, reciproc, wave 1, CM wire, martensitic with varying amounts of austenite and R phase, controlled memory effect, deformable, pseudoplastic, shape memory effect, super flexibility, enhanced cyclic fatigue resistance, the HIFLEX, gold heated, that increases the torsional resistance at greater angles of rotation so they don't fracture. It's the protaper gold or wave 1 gold. Blue heated can only go up to a very lower maximum torque. For example, the profile vortex blue, the reciproc blue, max wire, it's marked, its alloy is martensitic at 20 degrees and austenitic at 35 degrees, has shape memory effect, superplastic. That's the XP ender finisher and XP ender shaper. I don't think all this real detail is so necessary for your files, because I don't think you can choose a file system based on the alloy and how it's being treated. But I want us to look a little bit closer to that, and we'll talk about that in a minute. So what's the clinical advantage of heat activation and loss of shape memory? The advantages are that there will be reduced stresses made on the file during rotation in a curved canal. The file should follow the canal spatial orientation and curvature more correctly and safely without metal fatigue and ledging. Various file systems have introduced the gold file, which have been heat activated. And I would like to now introduce you to the blue heat activated file with even further increased elasticity. These will be used in sharply curved canals with decreased risk of file fracture. Of course, T's and C's applied. But let's take a look at that closely. Right, here I am again, and we're going to demonstrate with the gold file first. Right, I'll just move out the way so we can see that against the white wall. Here's the gold file, and again, I'm going to apply a bit of pressure on it, and you'll see that it holds that bend. Okay, But now when we rotate, it's not going to hold that bend in the opposite direction. Now, if the curvature of the root was in that left direction and we rotated, it wouldn't put pressure on the right-hand side of the wall. In fact, what would happen is that because it's soft, it would just flex to that shape. And so it does. As it rotates 350 revs per minute, it would keep flexing in the direction that you wanted. So that's the, I'll just put a lot more pressure on it. Hope it's clear. That's the gold. Now let's have a look at the blue heated. It's got a blue tinge on it. I don't know if you'll see that on this, unfortunately. Okay, we'll just put a bit of pressure on that again. You see straight away it holds its shape. So a little bit more pressure, and we can see that these are quite useful in S-curves type of canals. And it's really soft. It's almost like a touching, I don't know. It's just something like really like a plastic, actually. It doesn't feel like it's a metal, but we've shown that the torsional, the torsional strength is about the same. So, okay, you can get a good idea of what it looks like. Let's go back to shearing. And what are their costs? Well, let's take a look at my previous slide and see how they compare. Except now we're going to see the numbers. And we showed you that they compare quite favorably to all of the other files. So we're not looking at something that's way expensive. It's well in the reach of most practices, and they fare very, very well in the root treatments. And I'd like to show you some examples. In fact, at least one of them was done just of last week. I think that's the last X-ray that I will show. You can see the sharp curves right at the tip of the apex of that lower molar. Just a set of series. Good control and nice taper. Centered. I feel really safe using them. I feel that I do check my files after each entry. As I bring the file out, I'm checking to see if there's any unwinding, and I'm not finding much unwinding of the file. But right at the tip, we can already see that there is a little bit, we might see a little bit more of a shine to the file. That means it is unwinding slightly. In that case, then I would usually replace it with a new one. You've got nice control at the apex, a little button of cement through the tip there, which we will remove in time. I'm sorry about that. Beg your pardon. Right, we're trying to work in an office, and when you're at home, I think we all experience this. So I was just waiting for one of the kids to come running in and shouting, but everyone's behaving themselves in the back, so that's okay. And this tooth was completed with the blue heat activated file. And you can see there's beautiful control at the tip. They were long roots. They're probably around about 23, 24 millimeters, which makes me quite nervous that we're not going to have trouble near the tip. There's you can see that it's we've got good control and good fill near the apex. This is what I'm talking about, a beautiful root treatment. I'm sorry if I call them that, but I'm quite sure that when you see something tapered and looking like this, they've got a very good chance that they're going to be successful. This is the one root treatment that I've just done just last week, just completed last week, and this was with the gold heat activated files. So what can we say in the end? What's our summary? Let's just look at what's happened in the past. Let's look at a timeline. So 1964, we had the oscillatory file systems. Then moving on to the rotary centric, 92, that's conventional NATI rotaries. Then reciprocating in 2008, seems like yesterday. Axial movement, I think, came in and out of the endodontic world. Rotary eccentric, the wobble effect. The adaptive is we're in the adaptive phase now. And what my thoughts are that the future would be stressed in the metallurgic advances. Now, we've seen the metal advances through the last few decades, and if without them, we wouldn't have been able to have the reciprocating files, the wobble effect, or of course the adaptive files systems. So I think we should look out more in whatever system that you're using, that you look and see that do you have that file that has the loss of shape memory, because I think they should adapt to the canal a lot better. So that's my summary, is that hopefully with this future that we're facing now, that we'll hopefully have superb canal control and safety within the file system. If you want any more information about these files, you can email me. Be happy to answer any questions. Otherwise, it leaves me to wish you a speedy and safe return to practice. And thank you so much for your attention. I hope you have learned something. I've enjoyed researching the subject. I'm no expert in metallurgy detail, but as a clinician, that kind of attention to detail is not so important to me, more that feeling the files and it just making sense to me as I'm working in the file, and of course the clinical outcomes that are going to convince me that these are the file systems for the 21st century. Right, so we're back here, and I think there are some questions. Let's see if we can try and answer them. Why is the blue one more expensive than the gold one? I think they've gone through the normal heat activation and then the titanium oxide on top. So I think it's just in the process of manufacturing them. Which brand of gold and blue file did you use? Cost per pack file. Could you send me an email, and I'd like to answer it on the email, or you could go to the website and you could have a look. But I don't think this is the forum for discussing the cost factor. I think you'll find them extremely reasonable, sensible prices. They're good quality. What is the role of the heat wave in a K file? Heat wave, I'm sorry, I'm not sure I understand your question. Do you want to try that again? While we're waiting, I think there's another one. Oh, no, that doesn't. Oh, you said the difference between blue and gold, that what's the difference between the blue and gold? The gold is just gone through high temperatures, depending on the taper and the size of the file. And so the blue would have the same, plus the titanium oxide that's been treated with. I hope that's answered your question. I'd love you to actually hold them in your hands, feel how soft the blue is. There's one thing I've found just clinically, is that in a calcified canal, right, if you're trying to open the axis, I wouldn't try it with the finest blue file, because it won't be able to negotiate the canal, because it will just bend on entry. You just don't have, you need a little bit more, if you want power, as that the gold would provide. So the S1 is, the blue ones are fantastic, and all open ones that you've already negotiated to the foramen, and then take it over with the rotaries. But not in calcified canals. What's your view regarding reciprocating versus rotary files and the pushing of infected material through the apex? Many thanks, Adam. Right. I don't. How can I answer this? I'm happy with reciprocating and rotary. I personally use just rotary. I just find that the easiest. I'm not convinced that reciprocatory is safer. I'm not convinced that reciprocatory motion is faster, or it cleans better. But yet I'm cleaning vigorously with the sodium hypochlorite. And when I say vigorously, I'm not talking about pushing in the irrigation obviously in a pressured way. It's activated with ultrasonics, which limits us now with the COVID and the fallow time. That's just to bear in mind. And I don't believe that you're not going to push infected material through the apex and reciprocate. I don't believe that in reciprocation you won't push infected material through the apex. So basically, the blue. Someone wrote, basically the blue is more expensive because it is made with less temperature. No, I think it's just going through more processes. That's why it's more expensive. What is the most favorable taper? What is the most favorable taper? Most favorable taper, I think, is the most common one, is 6%. What we're afraid of is that if you bring the fullness of the taper close to the apex, we're going to be weakening in that area. And I'd be concerned of later root cracks developing. But it's enough for us to get a good fill, to get a good cleaning to the apex. Come on, there must be more questions. I hope I'm answering them clearly. Louise, I think that's it.
Yes, Gary, I think that's everything. So thanks so much for a great webinar.
Thank you. Thank you to everyone for listening in. I hope they all enjoyed it.
Yeah, it was great. Don't work too hard now.
Thank you.
Hopefully see you soon. See you now.
All right. Okay, so I just push leave, right?
Yeah, I can end it here now.
Thank you. Thanks, Louise. Bye.
Bye.